A worrying pattern has emerged, therefore, from Hassan, one that could impact thousands in Bengaluru as well as across Karnataka. Health Minister of Karnataka, Dinesh Gundu Rao, has flagged a higher heart attack risk amongst drivers, especially auto and cab drivers, following a series of sudden deaths among young adults.
ಆಟೋ ಮತ್ತು ಕ್ಯಾಬ್ ಚಾಲಕರಿಗೆ ಅವರಿಗೆ ನೀವು ಪ್ರತ್ಯೇಕವಾದಂಥ ಒಂದು ತಪಾಸಣೆಯನ್ನು ಮಾಡಿಸಬೇಕು ಅಂತ ಅವರ ಒಂದು ಸಲಹೆ ಗಂಭೀರವಾದಂಥ ಸಲಹೆ. ಖಂಡಿತವಾಗಿಯೂ ಅದನ್ನು ಕೂಡ ನಾವು ಮಾಡತಕ್ಕಂಥದ್ದಕ್ಕೆ ಅವಶ್ಯಕತೆ ಇದೆ ಅಂತ ನನಗೂ ಅನಿಸುತ್ತೆ. ಅದಕ್ಕೆ ಮುಂದಿನ ದಿವಸದಲ್ಲಿ ಎಲ್ಲ ನಮ್ಮ ಯಾರು ಆಟೋ ಚಾಲಕರಿದ್ದಾರೆ ಮತ್ತು ಟ್ಯಾಕ್ಸಿ ಚಾಲಕರಿದ್ದಾರೆ ಅಥವಾ ಬಸ್ ಚಾಲಕರಿದ್ದಾರೆ, ಲಾರಿ ಚಾಲಕರಿದ್ದಾರೆ, ಅಂಥವ್ರಿಗೆಲ್ಲರಿಗೂ ಯಾಕಂದ್ರೆ ಅವ್ರದೇ ಆದ ಸಂಘ ಸಂಸ್ಥೆಗಳೆಲ್ಲ ಇದೆ.
Between May and June this year, 24 sudden deaths were reported in Karnataka's Hassan district. Among them, 6 were auto and cab drivers, a number that has put the spotlight on mobility workers as a very high-risk group. Health Minister Dinesh Gundu Rao said that the government shall now work with driver associations to screen them for heart-related conditions and try to understand what makes them particularly vulnerable. Preliminary findings point to a combination of risk factors: poor lifestyle, roadside eating habits, pollution exposure, long sedentary hours and therefore lifestyle, and irregular sleep. A deeper analysis of the 24 deaths showed that 14 were under the age of 45, 20 out of 24 deaths were cardiac related, and more than 75% had one or more cardiac risk factors. These included obesity in 8 people, alcohol consumption in 8, diabetes and hypertension in 7 and 6 respectively, smoking in 6 individuals. Now, interestingly, 4 deaths were found to be non-cardiac, caused by kidney disease, gastroenteritis, a road accident and suspected electrocution as well. Among the cardiac-related deaths, 10 were confirmed heart-related deaths. 3 had pre-existing heart conditions, 7 showed clear signs of cardiac arrest based on autopsy or ECG evidence, and 10 were classified as probable cardiac deaths. The state's expert committee had now made 3 strong recommendations: autopsies for all sudden cardiac deaths outside hospitals, CPR training for the general public, mandatory cardiac screening for drivers. Minister Gundu Rao also added that even though Hassan hasn't seen a surge in numbers, the age of the deceased and the nature of deaths demand urgent attention and systemic reforms in cardiac care and awareness. My question is that how do you screen auto drivers, cab drivers, truck drivers? I mean, they are out to earn a livelihood. How is it even going to be possible? But let's ask experts, are there any other methods? But of course, also address this basic point. These are poor people out to earn a living every day, rain, hailstorm or floods. Dr. Ashit Sridhar will join us. He is the lead interventional cardiologist in Mangala Heart Center, Hassan. He is here. And Dr. Sameer Gupta, senior cardiologist, Metro Group of Hospitals. A very, very warm welcome to both of you doctors. Dr. Sridhar, how is it possible, considering 6 deaths out of these 24 odd were all cab drivers, auto drivers, truck drivers, to say we will screen them? The onus is on the state then. These cab drivers, auto drivers, bike taxi drivers, they are all up in the morning, ferrying people, earning a living. They are not privileged like I am. I am sitting in an air conditioned studio, sir. You know, I have the money. The point is, I can. Can you hear me, Dr. Sridhar?
Yes.
The point is that isn't the responsibility of the state, that is Karnataka government, to see to it that they take the onus upon themselves to screen all these mobility workers, sir?
So, the political part of it is not our area to look into, but what I would really want to emphasize here is that there are 2 things. One is that yes, all of the conversation has started, and all of these people who are in high risk, we are talking about the transportation people who are ferrying people in the out, whether it's auto drivers or taxi drivers. Basically, there are few things that are at risk, which makes them at risk. One is that the sedentary lifestyle, because they are suffering every day, they have to earn their life. They are focused on earning their life. They are unable to focus on the diet and lifestyles. Their eating habits, whether it is their exercise, whether it is lifestyle, these are all compromised. Moreover, their habits it also very much is highly prevalent in this group of population, whether it is smoking or alcohol. Obviously, they form a high risk population where the incidence and prevalence of coronary artery disease could be higher in this group of population. And definitely, yes, it's not only imperative that they get an ECG, echo, treadmill test done, and along with lipid profile, but it's also important that this conversation and this thought process has to move on. It's not that they came today with a scheme or something. They got their ECG, echo, TMT done. They got the lipid profile done. We tell them that okay, they are having a high risk for a coronary artery disease. We tell them that they have a high cholesterol levels, and then you forget about it. Because many of the patients, what I'm seeing is when Mr. Punit Rajkumar had a very unfortunate death, there was a sudden rush of this age group of population coming and getting tested. A lot of them were diagnosed to have a lot of risk factors with the dyslipidemia. We advise them medication, we advise them yearly follow-up, but they just completely disappeared into thin air. Now, with all these things happening, again they are resurfaced after discounting the medication and not on any of the follow-up, and again, not even focusing on the habits and lifestyle risk factors.
No, but you are right, Dr. Sridhar, that they may not focus, but the point is, your job is to tell us to focus. But if I'm busy the whole time, how do I focus? I am divided between earning a living and trying to focus. Dr. Samir Gupta, this is not the first time that these people are having this lifestyle. From time immemorial. Have you ever seen earlier also bullock cart, right? Someone relaxing? No, they are working from morning till night. They all have the same. What has changed suddenly?
A bullock cart puller
Sir,
and
sir, I'm asking Dr. Gupta. I'm asking Dr. Gupta. What is the sudden, you see the change, Dr. Gupta, that they have a sedentary lifestyle, they are smoking too much, they are drinking too much, therefore they need to have screening. Don't you think that there is something else also which may be at work, Dr. Gupta?
Ma'am, I think, first of all, it's very important that you are talking about this issue
Yes, sir.
of the increase or the prevalence of heart disease in this country, right? We as Southeast Asians are predisposed to having heart disease at a much earlier age group as compared to the Western people, and there are many reasons for that. Apart from just genetics. Now, when you look at heart disease, this incident that has happened in Hassan, which is being highlighted of the cab drivers, it points out a very important issue that heart disease is not a problem only of the affluent and the rich people. It affects all strata of society,
True.
right? Whether it's an auto driver, cab driver, everybody can have heart disease. So that is also a very important thing to first understand and appreciate, right? I think this unfortunate incident has really highlighted that. Now, talking about the next question as to what are the reasons why we are seeing this? Is there an increased surge? Well, heart disease is the number one cause of death in India and across the world. So, 1 in 4 people to 1 in 3 people, depending upon what statistic that you are reading, about 30% of deaths happen because of cardiovascular disease. So, 1 in 3 people will die of heart disease anywhere in India, right? That number may be a little bit higher in urban age group, a little bit lesser in the rural area, but not very much, right? Now, over the last 40, 50 years, if you see, like you were talking about somebody putting a bullock cart, somebody doing that work, that was a lot of physical work, a lot of manually intensive work was being done. So they were getting the heart
Just
was
a minute,
getting.
doc. I gave that example, but let me change it. Forget bullock cart. Auto drivers have been there since I was a child, which is a very long time ago. Cab drivers have been
Absolutely.
there. Truck drivers have been there. They were also driving. When we spoke about AIDS and HIV, when I did articles as a young woman, truck drivers were more prone to be sexually promiscuous because they were coming from one state to another, therefore. Now, I can understand that when you are moving, right? But I just don't understand that what has changed amongst them. Also, let's move on, Dr. Gupta. Don't you think then the onus is on the state that they should get screened? Where is the time? Where is the money for them to go and get screened, sir? Here it is hand to mouth existence for them, Dr. Gupta.
Yeah, absolutely. So one of the most important things in heart disease is prevention of heart disease, right? Prevention is always better than cure. So the prevention is getting your cholesterol checked, getting your diabetes checked, making sure you're not overweight. Even though these people, even though the taxi drivers and the auto drivers are working very long hours, it's not a very manually intensive job. They're primarily sitting down, and that is just the nature of the job, right? I mean, whether you're working in a corporate office or you're driving an auto, you're basically sitting down. You're not doing physically intensive work, which is good for you, right? So I think that also has to be taken into account. Then they're exposed to pollution, right? The pollution, there's a lot of data to show that high pollutants
That is the
increase the risk
point.
of
That
heart
is
disease,
what
they
I was
increase the risk
coming
of
to.
diabetes.
Pollution, both air pollution as well as noise pollution. Dr. Sridhar, apart from cab drivers, today we are concentrating on mobility workers, because they, 6 of them, so Dinesh Gundu Rao has also spoken about it. The point of the matter is, sir, that Hassan, because there was a lot of outcry that, oh my God, so many sudden deaths, but both the reports, one by Dr. Ravindranath and also by the center, has taken out the, COVID vaccine out of the ambit and said it's not because of that. Dr. Sridhar, the point is that how do we, because if we have to decrease these deaths, then we need to have a plan of action. What do you suggest should be the plan of action, Dr. Sridhar? Whether you are also young people below the age of 45, these are not auto drivers, but these are young people. They are also, they have also dead. Some of them have been working out. We have a very famous case of that star Appu in Karnataka. Look at him, Puneet Rajkumar. He was fit. He was absolutely endearable. I mean, I really liked him. So, I am saying this, he was no bad habits. He just dropped dead. So, Dr. Sridhar, what is the forward planning on this?
So the fact that we are discussing about these things, these are getting highlighted in the national media. We are discussing about it. This itself is a very, very huge thing. We have been talking about the young patients coming with heart attack. We are getting 21-year-olds, 25-year-olds coming with heart attacks, which was very unusual. But this has been happening for quite some time. It is just that there was never a media focus, nor the national focus, nor a state focus on these things. Now, with all these things happening, it's very good that a focus has come into it. Now we are starting the discussion. There are a lot of youths who are in 20s, 30s, and 40s. They are looking into these things. They are coming and getting evaluated. They are focusing on reduction of habits, whether it is smoking or alcohol. They are looking into whether they are diabetic or not. They are seeing whether they are hypertensive or not. People who are already been diagnosed diabetic and hypertension, they are getting checked. They are coming for regular follow-up. So this process, where we have started the conversation, where we are talking whether the state needs to come into picture and subsidize these investigations, whether there has to be mandatory talk about these things in the education institutions and in the employment or employee relationships, where these things also has to be spoken about, whether it's a workplace, whether it is the work hazard, whether it is a occupational part, where the organizations come into picture together, and then they as a community they participate in the awareness program about the cardiac illness, whether as group of organization they come in and they chip in and then
Okay.
try to get these patients evaluated. This is how it should move forward. The
All
more and
right.
more we talk about it, the more and
Yeah.
more we discuss about it,
I hope
there is more and more ownership.
yeah, I hope the Karnataka government sticks to this and Hassan does not just become a tick mark. I mean, I think there should be a follow up on that. Dr. Samir Gupta, all these tests cost money. I mean, government hospitals, of course, they are subsidized, but private hospitals, they do. Also, Dr. Gupta, I'll tell you something. Even during COVID, when I tried to convince a lot of people to go get tested, they said, Madam, anyway, we are going to die. I mean, I'm doing this job. My driver said that I may die tomorrow because of an accident. What is the guarantee? Tell me something. Isn't it very difficult for a state also to convince them to undergo these tests because they have these ready-made existentialist answers, Dr. Gupta?
I think it's very important for everyone. And I'm not talking about the Karnataka state over here that we're talking about. I'm talking about the country as a whole, right? Because at the end of the day, the country will prosper if all the states prosper. You cannot become a wealthy nation if you're not a healthy nation, right? So say that again. You cannot become a wealthy nation if you're not a healthy nation. And I think over the past few years, there has been a lot of emphasis that has been placed on um, improving the healthcare facilities in this country and in our society in general. Various health schemes have come up, the Ayushman Bharat, Every government has an equivalent scheme of sorts to treat patients with heart disease and heart attacks. And I think awareness also plays a very important role, like we just talked about. The person had to be aware that he should go and get his health checked up. And this has to come from a grassroots level, right from the Anganwadi workers up to, up to the family
Yeah, but
heads in the panchayats.
I think it's very tough to do. It's very easy for all of us to
It's
sit
very tough
and
to do.
discuss. It's
Absolutely,
extremely
absolutely,
tough
ma'am.
to
It's
convince them to say, okay, go get regular checkups because this is what is going to prevent a Hassan like situation. Dr. Sridhar, no politics here, only health, sir. But don't you think for these poor people, for cab drivers, auto drivers, bike drivers, something should be done so that these tests are made easily available? It's easy on their pockets, sir.
No, definitely, what you said is definitely true. The more and more the healthcare percolates from the city to the tier 2, tier 3 cities and rural center, obviously more and more
Right.
people will be able to do that. Now we have a existing facility in Hassan where we do primary angioplasty, so heart attack patients are getting treated. 5 years back, this was not the scenario. So going forward, obviously, when there is a percolation of these tests and the facilities into rural health setup,
Right.
obviously they don't have to waste a complete day. They don't have to waste a lot of money. Obviously, they will be willing to go and get it tested. There is no doubt about it. And the more and more healthcare percolates deeper and deeper into the Indian, rural setup, the more and more awareness and discussion happens. The more and more tests gets done. And obviously, 5 years back, I don't think these things would have been reported. Now, you people are looking into it. It has been reported. We are discussing. So there is a definite movement forward in these things, and we are very happy that it is happening.
All
Now,
right.
as far as the cost of it is concerned, yes, it's true that as much as possible, as long as possible, if it is made as state-sponsored schemes, the patients will be able to benefit from it. But as of now, I think it would cost somewhere between 3,000 to 5,000 for any of these people to get it tested. And yes, anybody who can afford it, anybody who can do that, I think it's imperative that we should take health on
Point.
our
They
hands
can't,
and start looking
most
into it.
of them cannot afford it.
That's true. That's unfortunate, sad story of our
They
country. Yes.
can't. They can't afford it, and that's why I began this conversation by saying, let the state come here and try and do something for cab drivers, auto drivers, truck drivers, so that they remain safe. They are very important part of our society and very, very important part of our economy as well.